So, good evening, doctors. Welcome to the second episode of Demystifying Testosterone. And today, in this episode, our beloved Dr. Sunil Jindal sir will take you through a male hypogonadism and well-being. Dr. Sunil Jindal is a chief consultant, laparoscopic surgeon, andrologist, reproductive medicine specialist at Jindal Hospital Trust. He is a scientific director at Dr. Madhu Jindal Memorial Test Tube Baby Center, and he is also a vice chairperson at Delhi ISAR. So over to you, sir.
Thank you very much. It is a pleasure as always to be here. And if you ask me at this moment, there is one thing which I have always felt, that the introduction of mine would be a father of 3 children, having an amazing wife, love my job. I'm a surgeon or urologist by training, and I'm an andrologist and IVF specialist by passion. I would love to bring you to this world of testosterone. And I would like to bring you to this world of testosterone because of the reason that this is one of the most misused, overused, and the most underused hormone. Now, why do I say it? I say it for the prime reason that I have personally felt that I get these patients, so many of them, especially those who come from the gymnasiums. And these people who come from the gymnasiums are those people whose are those people who actually have extremely large bodies, muscular men, aging and balding. Well, don't go on this, my testosterone loss of hair, would be having something like this. And these people, when they come to you, they either come to you because of impotence or they come to you because of one reason. And the reason is that their sperm count is down. And in most of these patients, testosterone has been misused. Most of the gymnasiums have a system in which they have hormonal clubs. They have hormonal coachings. And these hormones are clearly and simply available off the counter, which they use. So this misuse has given rise to a lot of people being hypogonad and hypogonadotrophic because of use of testosterone, or I would say misuse. On the other hand, you have a subset of people whose age is in the tune of 50 to 55, 55 to 60, 60 to 65. And these people normally are in depression. They do not want to work. They are listless. They lose interest in work. Their libido is down. Their sexual performance is down. And they call it something like a feeling of depression and go to psychiatrists. And these psychiatrists normally put them on antidepressants. So they come to me with these antidepressants and normally tell me that they have not been able to have sex for a long time and their libido has gone down. And you check these people and you realize the testosterone is low. When you place them on testosterone, within a span of about 2 to 3 months, the story returns back and their depression is gone. So it is the most used, misused, and underused hormone. Therefore, I would like to demystify to you today hypogonadism. You know, I had read something very beautiful. People listen to you when you give something to them. And today, I really, in the last 4 or 5 years, whatever I have understood, I would like to place it as simply as possible so that you could utilize it for your patients. So I'll begin the presentation now. So I would like to demystify testosterone. And bring to you a situation where I would like to just explain to you a few things. Now, we need to understand that even before the hormone testosterone was discovered, one thing was very clear, that people knew one thing, that by castration, they produce slaves who are obedient. Badshah Akbar, Badshah Humayun, in सब के हेरम्स में, normally the people who used to guard were not eunuchs, they were castrated men. And whenever something like this happens, the aggression of the human being goes down and they become obedient. And this obedience in civil servants and soldiers is considered to be, what used to be considered was to be, that there is something in the testes which leads to obedience. Though the muscular development of these people was better than women. In the Victorian times, in the choirs, to prepare choir boys, they used to castrate young boys. So what used to happen was, their voices never were able to have the bass. And these voices were shrill and they could sing the hymns in a high-pitched way. So this was utilized for a long time. It was not until 1935 that it was discovered that the essence and the abstract from the bull's testes, which was taken out by Ernst Lacquer, was the essence known as the hormone, which was testosterone. So testosterone is something which is essential. It is essential for the development of secondary sexual characters in the male during puberty. And it leads to various things in the human body, as the development of lean muscle mass, bone mass, spermatogenesis, libido. It improves the insulin sensitivity and glucose metabolism. We need to understand one small thing, that the hypothalamus works on the pituitary to release FSH and LH. FSH and LH work on the testicles. And in the Leydig cells of the testicles, the LH works to produce testosterone. Now, this testosterone has a negative feedback on the pituitary. And this is the basis on which testosterone is regulated. Now, this particular fact is very important, because based on this one single diagram, which I have displayed over here, you would understand the mechanism of action of the hypothalamic pituitary axis to form testosterone. You know, the beauty about men is not only because of how beautiful they are from within. It is also because of the beauty which testosterone gives to the man. And this testosterone is 97% bound either to the plasma, albumin, or it is tightly bound with the sex hormone binding globulins. The rest circulates freely. And the circulation of this freely takes place in the form of bound and unbound form. The circulating testosterone is either used or degraded. So see, we need to understand the importance is not only of the free testosterone, the importance is also of the bound testosterone. And the total testosterone gives us the binding, and the free testosterone gives us a situation which is the utilizable testosterone. Mr. Vinod, can you please remove the pin from Vinod and put it onto me, please? The pin is lying on Vinod at the moment. Now, the outline of what my presentation is going to be, I would like to introduce to tell you what it is, the testosterone which I have. I would want to tell you about what is male hypogonadism. And I would also, can you please pin me and not Vinod? I would also like to tell you about the testosterone replacement therapy, of how you do it. I would bring you a few clinical evidences, and then I would like to summarize of how you need to use testosterone. Now let us go to a situation where we would like to know what is male hypogonadism. So male hypogonadism would be described as a clinical syndrome resulting from the failure of the testes, because of which the sperms go down, and it is due to disruption of one or more levels of the hypothalamic pituitary testicular axis, which I had spoken to you about. And when you talk of testicular deficiency syndrome, it is characterized by the deficiency of testosterone level without changes in receptor sensitivity. And what we need to understand is, in this syndrome, there is also a variability which is referred to as hypogonadism or late onset hypogonadism. Now, what happens is, in these, the testes start producing less testosterone. And when they produce less testosterone with age, it leads to hypogonadism. And this is what at times is suggested as andropause. Now, if you ask me about the definition, we need to understand is that it depends on the clinical signs and symptoms, and also on the cutoff level of serum testosterone. If the cutoff level of serum testosterone, if the cutoff level of serum testosterone is down, which means there is some problem with the net. I'm just getting it right. Huh? Can you hear me? Is it okay? There was some problem with the net, I felt. Is it okay now? Mr. Vinod, is it fine?
Yes, sir. It is audible and clear.
Now, can you do me a favor, please? Your video is spinning. When I'm decreasing the video to a single, please make me the administrator, Mr. Karan, so that when I decrease the size, it is only my video available. I can only see Vinod's video. Please do this for me, please. Okay.
Gaurav, please make sir post.
Now, Karan, I can see yours. Just do it to me. Just pin me, please. Just pin me, please, because it's disturbing me in the presentation. Have you pinned me? Okay.
Yes, sir.
Now it's fine. Please
Done,
do this.
sir. Done.
Please do it in the future, please, because it becomes very important for me. Thank you very much. Now the cutoff of testosterone is around 350 nanograms, the way it has been considered by a lot of associations. We need to understand about testosterone one small thing, that it declines with aging at the rate of 1% per year. In some studies, it has been reported that the mean serum testosterone concentration at the age of 75 is 2/3 of what it is 25 years. Now, according to one calculation, above the age of 60, 20% of men have low testosterone, and 50% of men older than 80 years have low testosterones below the normal range of a young man. So we need to understand that it's a natural process of this testosterone to go down. So it is not unnatural. And this is the reason that if after the age of 50, you have a man who says that his listless and libido has gone down, you need to test his testosterone. Now, the recommendation is that low testosterone itself is not hypogonadism till it is matched with the symptoms and signs of low testosterone. So you do not test a man if there are no signs or symptoms. What do you measure? You measure the morning sample of total testosterone from a reliable laboratory. You have to confirm it by doing a repeat total testosterone or free testosterone. And you would do a free testosterone if you feel that the serum binding globulins are incorrect or they are decreased or increased because of some disease. Otherwise, you would like to do a total testosterone because getting a good free testosterone assay is difficult. And this evaluation should not be done during an acute or subacute illness. Now, there are a lot of thresholds which have been given by different organizations. But what is very, very in consensus is that if a man has a testosterone below or equal to 350 or 315, 325, please consider it a low level. We have to not only look at a low testosterone level, we also have to look at the low normal. So what does testosterone do as an enigma? It leads to a lot of male well-being and chemical changes. It has a role in male infertility, male sexual health, male hypogonadism, and also the female. But mainly, if you look at it, we would talk about the male hypogonadism. So there are two types of hypogonadism. One is primary and the other is secondary. Primary is when the testes functions less, and because of this testes functioning less, there is low testosterone, impaired spermatogenesis, elevated LH and FSH, and testes do not respond to hormonal stimulation. I'll give you an example of this. It could be primary testicular failure, or it could be something like Klinefelter syndrome. So if you look at this, in the normal axis, you are going to have LH and FSH which is produced. This would go to the testes. The LH will produce testosterone and the FSH will produce sperms. In a primary hypogonadotrophic hypogonadism, the testes function low. Testosterone decreases, sperms decrease, and LH and FSH rises. While a secondary hypogonadism is a condition in which the secretion of LH and FSH is low. And the secretion of low FSH and LH lead to a low testosterone and low sperm production. Now, I have got an algorithm for you to understand that in any patient who comes to you, what do you have to do? You need to take the history and a good physical examination. You have to ascertain symptoms and signs of testosterone deficiency. You have to evaluate for systemic illnesses, drugs, nutritional deficiencies, to see if that is the reason for the low testosterone. Now, in case you find that you have evaluated the man, you would like to measure a morning fasting total testosterone. Now, once you have done this, you could have two situations. You could have a normal testosterone, or you could have a low or a low normal testosterone. If it is a low normal testosterone, you are going to repeat a morning fasting sample again. Now, in the same second one, if you get a low testosterone or a low normal testosterone or a low free testosterone, you are going to measure the LH and FSH. Now, if the LH and FSH are low or inappropriately normal, you would consider secondary hypogonadism. And in these patients, you would measure prolactin, iron saturation, and get a pituitary MRI done. But in case you find LH and FSH as high, then you need to get a karyotyping done, and you need to assess the patient for the reasons of primary hypogonadism. There are a lot of reasons which I will not go into because it would make the talk very long, but the recording of this will be provided to you. I would tell you a number on which you could WhatsApp to me, and I could send you the link on the WhatsApp itself. Now, this is a beautiful questionnaire which you can give to your patient. And there are questions like, do you have a decrease in libido? Do you have lack of energy? Do you have a decrease in the strength or endurance? Have you lost weight? Have you noticed a decreased enjoyment in life? Are you sad, grumpy? Your grumpy is very important because in English there is a word known as a grumpy old man who gives a tough time to everybody in the family, including the children, the wife, everybody. These grumpy old men, please do a testosterone. You would ask if there is a recent deterioration in your ability to do any physical work, even play sport. Do you feel tired to get asleep immediately after dinner? And is there any deterioration in your work performance? Now, this is what is known as androgen deficiency in the aging male. I'm sure you got it. If you got it, please take a photograph of this and keep it with you, because these are the questions which you need to ask from any man who over 50 says he's not interested in work. Now, if you look at the signs and symptoms, so they have been categorized on 3 areas: sexual symptoms, non-sexual symptoms, and signs. So you could have a decrease in energy vitality. The person would say that he is unable to walk more than 1 kilometer. There is a poor mood. He feels sad. He's in some blues. There is impaired cognition, sleepiness, fatigue. There are hot flushes and sweats. And the person cannot concentrate and says, I have a poor memory. These men also have an increase in the waist circumference. I mean, you would suddenly realize that these are the men, you must have seen a lot of men, old men, who have very big bellies. And they say, umr ke saath mein pet to niklega. That's because the muscle mass has gone down, and these people have an increase in waist circumference because of decreased testosterone. There are reduced testes and prostate volumes. There would be less of beard gynecomastia. Now, these people also have something which you would then ask them. They have a low sexual desire, infrequent morning and nocturnal erection, and they have poor orgasms and sensations. They could have anemia, decreased bones mineral density, obesity, and reduced muscle bulk and strength. Now, how does it go about? So as the testosterone goes down, normally the first to go is libido and loss of vigor. Then people start becoming overweight. Then they go into depression, and then they have erectile dysfunction. Now, there are a few things which are most important. Please take a snapshot of this. Please do not start testosterone if there is a breast or prostatic cancer. If you have a palpable prostatic nodule and induration, and if the PSA is more than 4 nanogram per ml, if there is an untreated prolactinoma, if the hematocrit is more than 50%, if there is untreated severe obstructive sleep apnea, if there are lower urinary symptoms as of prostatism, if there is uncontrolled heart failure, and there is decreasing fertility, please don't give testosterone. Now, what is the goal of our treatment? We would like to get secondary sexual characters for them. We would like them to have a sexual function. We would like to get their body composition into perfect shape. And we would like to improve their quality of life. Now we need to understand one small thing. You could have an area, but in case the testosterone level is below 325 or 315, please get a second test done. If it is low, the patient has erectile dysfunction, mood libido problems. These are specific indications to start testosterone therapy. Now, what are the options we have? We have different options. We have oral, injectable, and transdermal. In transdermal, one thing which I would like to bring to your particular notice is, if please tell these patients that this transdermal needs to be applied on non-scrotal and non-penile skin. Because the patients, if you do not tell them, apply this gel on the genitalia. So please tell them this is to be applied on non-genital intact skin. Now, the onset of effects, the way it takes place, this is a beautiful table which I'd like to show to you. That the first thing to come back normally within a month or in around 1 or 2 months is the libido. Next comes the vigor. Next goes away the depression. Next improves the red blood cell count. Obesity with exercise, of course, takes about 5 to 6 months. Insulin sensitivity takes about 6 months. Erectile function improves within around 5 to 6 months, and bone density takes about a year. Now, the contraindications I have told you already: prostatic cancer, breast cancer, nodule, if the hematocrit is high, if there are lower urinary tract symptoms, if the PSA is more than 4, if there is untreated severe sleep apnea, or if there is an uncontrolled congestive heart failure. Now, there are a lot of preparations available. There are oral, they are injectable, and they are gels. Now, the advantages of each is different, and the disadvantages of each is different. But on the whole, most of the oral preparations lead to a problem in the liver and are degraded in the liver. And they also can lead to some areas where they can disturb the cholesterol mechanism. And since normally you need to give them in a population which is 50-55, it becomes very precarious to use an oral testosterone preparation. Now you would ask me, why not use injectable? You can use injectable. There are good preparations. There are short-term preparations, long-term preparations. But the problem with injectables is the fluctuation of the testosterone level. And if you give them a long-term injection, say for an injection every 10 to 14 weeks, the problem is you can't withdraw it immediately if there is a side effect. So the third comes is gels. Gels today are the best form of giving testosterone. I have been using these gels. I used to use oral, I've used injectable, but for the last 2 years, or I would say more than 2 years, I have shifted on to gels for people who can afford them. For two reasons. It gives a very good level. It does not lead to much changes in the HDL, LDL, and they are extremely safe. And if I need to withdraw them, I can withdraw them immediately. And of course, there are no fluctuations. So I've just told you why I normally use a gel. Now, something for us to understand is that how do you use testosterone? So we need to understand one small thing. Whenever you use a gel, there is a calculation for the gel, which I'll tell you. It is a very easy thing to apply for the patient. It is invisible and it has the ability to reverse the dose immediately. Now, something for us to really get is it is not to be used on genitalia. And it leads to the development of external and internal genital organs, secondary sexual character, protein anabolism, and it also leads to what we know as the electrolyte balance. Now, how do we use it? Now, we need to understand one thing, that 5 grams of gel is equivalent to 50 milligrams of testosterone. And 50 milligrams of testosterone is equivalent to 4 pump actuation or 1 packet of 50 milligram. Now, how do you start applying it? You start applying it in these men by telling them that you start taking it in terms of 4 actuations. Now, these 4 actuations would be around 50 milligram of gel. So they would apply 50 milligram of gel. Now, if after 3 months you check and you see that the testosterone level is down, you can increase it to 75, which is 6 pumps. But the maximum which you normally or I have tried is about 8 pumps or 100 milligrams. I normally would not give more than that. But 90% of my patients normally have a regular and good level with 50 milligrams. Now, how do you monitor? Now, this is a very simple way of monitoring, and I'm going to place it and tell you very, very comfortably how to monitor this. The first thing you need to do is when you start testosterone therapy, you need to examine the patient, do a per rectal examination, see if the prostate is normal in size. And in our Indian population, normally if the patient is around 50 years of age, I get a serum PSA done. I would explain the patient that there is a very low risk of prostatic cancer, but since we'll monitor you, it would be as safe as. I would evaluate the patient at normally 3 to 12 months after treatment, and I would monitor testosterone after 3 to 6 months and then on an yearly basis. I would check the hematocrit at the baseline and after 3 to 6 months, and if the hematocrit of the patient is more than 54%, I would stop the testosterone. I would normally measure from the spine, BMD, and in case it has enhanced, great. For men 55 to 69, always check the PSA before initiating, and then do it from 3 to 12 months. If the rise is more than 1.4 nanograms per ml in 12 months of initiating, you need to stop it. In case the PSA is more than 4 nanograms, you need to stop it. And in case there is worse of urinary symptoms, which means prostatism kind of symptoms, you may need to stop it. Now, I would come to a few papers for us to understand how do we go about it and how it is. Now, the first choice, as per literature today, by a lot of papers, is transdermal testosterone preparation, which is the first choice. And this is the closest to optimal androgen substitution as they mimic physiological diurnal variations. Additionally, short-term transdermal preparations offer the advantage of rapid testosterone discontinuation in case there is any kind of adverse effect, which I have spoken to you about. Now, what are the adverse effects? It could lead to erythrocytosis, I had spoken to you about, acne, oily skin, subclinical prostatic cancer, growth of metastatic prostate cancer, reduced sperm production and fertility, at times gynecomastia, male pattern of baldness, growth of breast cancer, and induction and increasing of obstructive sleep apnea. Now, in most of the patients, it has seen that you have to give these people a long-term maintenance of testosterone, because in this age, the testes is not producing it. So you need to give them testosterone and monitor these patients yearly. Now, from a lot of testosterone trials, I've tried to put in all the points together. And we need to understand, in a sexual function trial, testosterone increased sexual activity, sexual desire, and erectile function. There was an anemia trial which showed that testosterone increased hemoglobin in both men and who had anemia and in those patients who had unexplained anemia. In the bone trial, it was found that testosterone increased the volumetric bone mineral density and estimated strength of the spine and hip. And in the cardiovascular trial, testosterone increased coronary artery non-calcific plaque volume as assessed during CT angiography. But in patients who suffer from severe cardiac disease, this drug is not to be given. Now, in hypogonadal men, the number of erectile events per day, the penile rigidity, number of erections successful for intercourse increases significantly with testosterone therapy and increases the number and duration of nocturnal penile tumescence. See, what we do is, when we put on the meter for this, we are normally able to judge that what is the tumescence when the man is sleeping. And this increases when the testosterone has been given. It leads to a decrease in the anxiety and irritability in chronically hypogonadal men. Now, the positive effect of transdermal testosterone gel is on bone mineral density previously identified at 6 months of treatment, continued over a period of time. And it is seen that it has been seen much better in the spine than the hip. There were minimal side effects with transdermal gel on lipid levels, levels of prostate-specific antigen, and in general, it is seen that when the gel was given, it was relatively safe. Now, these are all the trials, but what we need to understand is that there has been normally an improvement in all the parameters which we were talking about when it was given from 6 to 12 months. So you need to give this for 6 to 12 months and monitor the patient. Now, as far as the sexual function is concerned, now testosterone has been able to significantly ameliorate erectile function and to improve other aspects of male sexual response in hypogonadal men. But the most interesting thing is, like, I have a large subset of patients, and this large subset of patients is those patients who are taking in sildenafil or tadalafil. And when they're taking sildenafil or tadalafil, these people are not able to improve. And they say that at one time sildenafil used to work, now it is not working. When you do a testosterone of these men where sildenafil is not working, you realize that they normally have a low testosterone, and you add a testosterone gel with sildenafil and things start functioning. So I would now like to summarize it. And when I would like to summarize it, I would like to say that hypogonadism affects men of all ages, either through congenital or acquired causes. For patients who have clinical symptoms associated with low testosterone level, treatment is essential for the prevention of sexual, cognitive, and bodily changes. A variety of treatment options are available, utilizing different dosage formulations and providing patients with choices that best meet their needs. And testosterone gel is highly recommended testosterone replacement. The effects of testosterone and sexual function in men: it has been seen that the number of erections per day improve, rigidity is better, with sildenafil the effect is better, NPT is better, there is a decrease in anxiety and irritability in chronically hypogonadal men. In nutshell, the grumpy old man who has a lot of weight, and one man who at this time feels listless, when you give him testosterone, his life changes. Now, for something for us to understand at the end of the lecture, the way I would like to place it for all of you is testosterone is one of the craziest hormones for the man and also for the women. It is one of the most least, I would say, understood hormone out of all the hormones for two reasons. That it has male hypogonadism has not been used by most physicians as a treatment at times for depression and aged men, and more importantly जिस इंसान की उम्र ज्यादा हो जाती है ना, उसकी असल में दुनिया परवाह करना कम कर देती है. पिताजी को ऐसे ही बोलना है, ऐसा ही चिड़चिड़ा रहना है, is a belief which people have. ये हमेशा टोकते रहते हैं, इस उम्र में हर आदमी करता है, is a belief which people have. Please see if this is present. Try to treat it, get a testosterone level done, and use this drug. It's a wonder drug, and stop the misuse of this drug. I would really like to thank all of you for the patience and time which you have given, because honestly speaking, it's fantastic. Now, the recording of this, I could give it to all of you by WhatsApp. If you could note down a WhatsApp number. Now, I'll just give you the number if you could note it down. Now, this is the number of on which if you send a WhatsApp of your contact, they would send you the recording of this. So the number is 800 6666 085. I would repeat it again, 800 6666 085. Can the IT team please type this number in the chat box and leave it there? 800 6666 085. Vinod,
Yes, sir. I am typing.
because I know when you type, it will not go into the chat box.
IT will.
It will go only into the chat box when the people who are running the show type it in.
Yeah. Understand, sir. So I ask Karan, can you please do that for us? Yeah, he had already typed, sir.
Please note down
Done.
this number. Yeah, Karan, have you? Yes, fantastic. Now, please note down this number. Save this number. Once you have saved this number and you send your WhatsApp number contact on this number, they would save it and broadcast to you this presentation, which you can utilize then. That's the way it is. Now, there are a lot of questions, Vinod, which must be there, which probably you would like me to answer.
Sure,
Now,
sir.
in case you would like me to answer these questions, please type in, bring it on, BIO into the chat box, please. BIO into the chat box, please. And I would like to answer all your questions which are there. So whatever questions they are there, they probably would be there which have been sent earlier or which are there in the chat box now. Let me answer all these questions. So, Mr. Vinod, can you ask me the questions which are there?
Sir, first of all, thank you so much for detailed insight on role of testosterone in male hypogonadism. And being a normal person, like a marketing person, being a product manager for this brand, it was very much clear for me, and I believe for my respected doctors, it is very much helpful. Sir, we have a lot of questions. That there is a plethora of questions comes to our portal. So most of the question has been answered during your presentation only, because the people used to register themselves 1 day, 2 days before. So there are some relevant questions to this topic. The first one is how to treat male hypogonadism with testosterone gel and dosing schedule. Sir, am I audible?
Anga, hello.
Yes, sir.
Yes, please repeat it. There was a Wi-Fi problem. I couldn't get it.
Okay, so the question is how to treat male hypogonadism with testosterone gel and its dosing schedule.
Okay. See, though I have answered everything, and if you have noted that number and you send me a WhatsApp on that number, I will send you the whole presentation. But still, if you've asked me this question, I would repeat again. You would first examine the patient, take a history of this patient. If this patient has symptoms, get a testosterone done. If the first testosterone level comes as anything equal to or below 350, 315, repeat it again as a morning fasting sample. When you have taken 2 samples and they are low, you would do a PR examination to see that there is no nodule. You get a PSA done if it is normal. Get a hematocrit done as the baseline. Start this person on testosterone gel. Start with 50 milligram. 50 milligram means 4 pumps. Use it on anywhere the shoulder or the chest. Leave it to dry. That's it. As simple as that. Get a second sample done in 3 to 6 months. Though you could repeat it after a month or so. See the level. If the level is in tune of 500, 600, 700, great. If it is not in that level, then increase the dose. Put it to 6 pumps. 6 pumps would be 75. If it still does not improve, 8 pumps, equivalent to Equivalent to, Vinod?
Sir,
Equivalent
it's
to?
equivalent to 50, 100 mg.
Very intelligent. So I got a chance. I see the question is, I as a teacher don't have students over here to ask questions. So the only person I have over here is Mr. Vinod Pratap, who is from Intas company. So I want to check if he knows or not. And
Sir,
great.
this is my brand. Thank
Fantastic.
you.
So that's the way you do it. So that's the way I treat my patients. And I'm wanting to say, tell you this because I believe in one thing. If in a webinar, I'm not able to give you a take home message, there is no point of my speaking over here. In fact, if I'm adding value to you, your practice, your patients, and the fact that once you treat these patients, it rises monetarily for you, that is when this webinar becomes successful for me. So that's how you do it. Next question, please.
Thank you, sir. The second question is, in Indian scenario, what is more significant, total testosterone or free testosterone?
You know, it's a very nice question. Why? Because it's very difficult to get a free testosterone done well. The free testosterone, the best parameters which you can get are normally when you calculate the proteins, calculate the sex hormone binding globulin, and with that calculation, you take out how many, what is the free testosterone. So it is very difficult. And since the free testosterone is very difficult to calculate, you would get done a total testosterone. But you need to get a free testosterone done in a few areas. If the sex hormone binding globulin are, I would say, in a disarray, or in case the repeated values given to you are at the low normal of the total testosterone. I think that answers the question.
Yes. Sir, the next question is, if we give testosterone gel in ED patients, what effect will it have on spermatogenesis?
See, this question is, there are two different questions in this. So the first question is giving to ED. You would only give it to an erectile dysfunction patient if the testosterone is low. So if you have a patient of erectile dysfunction, and this patient is in the age group post 50, in the investigations, you would get a total testosterone fasting done. And if the total testosterone fasting is low, and the patient does not have any other symptomatology, and he says he has a loss of libido, you would go ahead, give him testosterone. These are the patients where it would help. And the second area where it would help is, you have given sildenafil to a man, it was working, now is not working, or sildenafil is not working, he's a grumpy old man with obesity, get a testosterone done. If it is low, and if you give this drug with um, sildenafil or tadalafil, it will start working. Now, the second thing which question was infertility or spermatogenesis. You know, that's a full hour lecture, which is my next lecture. And the interesting thing is, I was to take it on next week, which was the 20th, but it has been postponed to the 21st. You know why? Which is the day on the 21st? Please type in the chat box. It is Father's Day. Father's Day on the 21st of June. And therefore, I'm going to take a full lecture on medical treatment of male infertility. So all of you 100% join in and send me a message today on the WhatsApp number I have given. I will send you the details of that lecture completely on your WhatsApp once that number is there. And this is going to be where I will tell you everything about testosterone in male infertility very, very clearly. This is what I would do. Next question, please.
Sir, The next question is, this is the last question, sir, because the questions are almost similar to that the previous one. The high dose of statin can cause rise in liver enzyme. Can testosterone gel also raise liver enzyme?
You know, it's a very interesting question for two reasons. That oral testosterones, even without statins, increase the liver enzymes. So oral testosterone has a very big problem with this. Compared to that, the testosterone gel, because it does not go to the liver to metabolize, and the metabolism in the liver is very less, is very safe comparatively. So if you use oral, there is a problem of the liver, but not so for the gel which could be used. So I think this answers the question.
Right, sir. So this is all about the questions, sir, because there are so many questions which are similar to that one. Sir, thank you so much for your time and your the kind of knowledge you are share with our customers are very much useful, very much informative. And as you mentioned that on 21st on Father's Day, you are going to take a thorough presentation on male infertility treatment. So we are eagerly waiting for that. And I believe our doctors are very much waiting for that. So thank you so much once again on behalf of Intas. We are very much thankful to you, sir.
See, first of all, thank you very much, Intas, for this program. Not because of your testosterone gel. I'll tell you why. I am thankful to you for the prime reason that you have taken out this program for me to personally explain to people.
Sir, we can't hear
So
you.
your sound is not coming.
Now, can you hear me?
Yeah.
Yes, sir. Yes.
Now, one thing for us to understand is that I'm talking about testosterone gel. I used to talk about testosterone injections when it was used, but I have realized that this has been a marked change in the way the delivery system has changed. And this delivery system, now I just wish one thing, testosterone gel in the United States is exorbitantly expensive. Oh my goodness, it's so expensive, I can't tell you. But even today, the testosterone gel compared to the injections is expensive. But my realization is it is not so expensive that people cannot take it. And a very large population is benefiting today from testosterone gel. So there are two basic announcements which I'll make in the end. I'm thankful to all of you who have attended this because you really want to use whatever knowledge you get for your patient benefit, which is amazing. Because we as doctors, people do not realize, work day in and day out only for our patients by our original design. The design which people think is different, but the design is the original design of wanting to do something for our patients. And this is the reason you have spent time. And I have tried to justify and to bring to you in this time something which could be useful. So I'm so grateful to you, wonderful people, for being here, for listening to this talk. Thank you very much. My next talk is on male infertility medical treatment and testosterone. Do not miss it. It is next week, not on Saturday, on Sunday, which is Father's Day. In case you have WhatsApp on that number, your WhatsApp contact, you would send it. Otherwise, Intas people also will send it and the presentation would be there. Thank you very much. And I see that Mr. Satpathy has joined over here, which is fantastic.
Thank you so much, sir. It was really wonderful, and I'm sure the audience must have enjoyed the whole talk and the presentation. I think day by day, with every program, it is becoming more interesting and more curiosity is generated. So I'm sure the next program is going to be much better and much interesting. Again, we have the fourth one also in the row.
Wow, lovely.
So thank you so much, sir. Thank you for taking out your time and doing this program for us.
Thank you very much, everybody. Thank you so much.